Yes, hello all. My voice is audible. Is it clear? Please do text in the chat box. Is my voice is clear and is screen is visible? Any resound is anything problem? Please do text. We'll start soon. Now echo is clear. There is no echo, right? Yes, yes. Thank you. So before going into the session, like how many of you have joined the art of understanding of Metromedica? And how many of you have viewed the same art of understanding Metromedica from YouTube? Please do text in the chat box. And what are the inputs you gain from that? That art of understanding Metromedica is quite linked with this session of case taking. So those who have already have viewed art of understanding Metromedica will completely understand this case taking with interlinking with Metromedica. So how many of you viewed art of understanding Metromedica completely from the starting to the end? Okay, okay. So today we will understand the art of case taking, how we can dig the information from the patient, what are the rules or regulations, and how the patient express herself, how to observe, what to observe in a case. Everything in this session, I think, a eye-opening session in this new year. So many people have studied Metromedica, have enough knowledge of understanding each and every remedy, enough knowledge of picking in the rubrics, enough knowledge of understanding organon, or enough knowledge of each and every remedy, their keynote, key prescription. But if you don't have the enough knowledge, or I can say the proper knowledge on case taking, the Metromedica knowledge or the repertory knowledge is of van, is of no use. So I hope this session will be an eye-opening session, and this case-taking session is not only linked with the aphorism from 83 to 104, but it is linked with Metromedica, understanding, observation, what to observe in a patient, how to ask cross questions to the patient, how we can confirm a remedy to the patient. Everything I will tell in this session. Please do concentrate well. And a small announcement here. Before starting into the case taking session, we are coming up with Kali salts and its comparison, understanding of deeper patterns with Metromedica and rubrics with lot of clinical tips. So this session is a paid session. We are coming up with in this next month of February. The dates will be shared in the group. So what we can be studied in the Kali salts and its comparison, the salts of potassium. What we learn from this session is outline of their constitutional appearances, how we can look Kali salt, how we can look Kali carb, how we can look Kali brome, Kali bi, causticum, Kali arsenicum, how we can look the patient, how we can understand that constitutional appearances we are coming up with, and understanding Metromedica of the particular drug from all important books, group study of the remedies, especially for UG students. In exam point of view also, we have collected a lot of information of group study, the comparison patterns, and stalwarts experience of the remedies with lot of case discussion, understanding the genius of the remedy. As is in the previous session, we have understood what is genius, the location, the modality, that concomitance, the general trait, the general mental state, everything. So connecting with the delusion rubrics, we can understand the genius there. Mind rubrics and their comparison with other remedies, confirmatory symptoms, and how to find these remedies in clinic. And this session is coming up with in February. The dates will be shared in the group, and 6 months of access will be available for this session. The fees is very limited, 350, only 350. We are covering around 15 remedies. So if you divide 350 into 15, per each remedy you are just paying 20 rupees. One remedy you are paying 20 rupees. We are giving enough amount of knowledge on each remedy with their single rubrics, mathematical deeper patterns. Try to understand, try to join. This will be the session you can understand all the Kali salts at a time, the comparison patterns. So what are the remedies we cover here is Kalibai, Kalibrome, Kali iode, Kalipos, Kalisulf, causticum, Kalifersinatum, Kali arsenicum, Kalisulf, Kali silicia, Kali picricum, Kali nitricum, Kali mure, Kali floor, and Kali carrier carb. So these are the 15 remedies we are going to cover in a session with Metromedica rubrics with lot of clinical tips how to identify. So these are some gist patterns. We have already completed the PPT, but here I am sharing what we are included in this session is how a conflict of Kali you can see. There is a lot of attachment and detachment. This is the conflicts of Kali. That's why Kali is more interlinked with a lot of family issues, family member issues, anxiety for family, the attachment you can see, the detachment you can see, lot of dependence and independence, lot of fear of failure. Along with the achievement there is a fear of failure. So we are not only concentrating on one pattern of Kali, we are concentrating on the whole, the polarities of Kalis from the starting point of view or from the success point of view, and the failure of Kali, the success of Kali, and the middle of Kali. This is what we are going to cover. How Kali cooperate, what is the competition, emotions, intellectual, holding and leaving, hardening and sacrificing. What are these keywords? How we can link these keywords in Kali? Just a gist we are going here. Who is Kali actually? To understand Kali, you remember just RRR, 4 R's. One is rigid, reserved, reliable, routine. How this rigid character, how this reserved nature, how this reliable and routine nature can be seen in Kali. They are strongly principled, strong sense of duty, strictly follow routine, seriousness and sincere, reliable and dutiful. So why these Kalis are so much principled? Why these Kalis are sense of duty? Why they follow so much of strict routines? Complete evolvement of mind, complete evolvement of psychosomatic of Kali group, psychosomatic of Kali cells we are about to explain you. We are about to dig it. We have collected a lot of information from different sources, original sources books, and we are coming with you, with in front of you, just to understand Kali and their salts very beautifully. You have never learned before. And what Kali feels and how a patient says the word is inner feeling, no structure. They says, doctor, I don't have any structure. I don't have any identity of myself. Everything I need to depend on my papa or my mom to bring anything, to buy anything, to study anything. The dependence, the children come and say, or the parents come and say, or a husband or a wife come and say, doctor, I completely depend on my husband. Completely. I don't have any identity. Without them, I cannot live. That's why I have this fear of alone. I cannot stay alone. There is a lot of anxiety, many more depressive cases. You can fall into these Kali salts. This is the modern remedies, the modern era, how the generation is going on. These Kali suits, all the Kali suits. They must be connected with people around them to give them identity. If any diverse, there is a tremendous anxiety of being alone, you can see. So the big Kali is they cannot stand alone. The inner structure is not there. That is what they completely dependent, very dependent is Kali. That is why there is one psychosomatic link. Almost all Kalis develop back pain because back is support of the body. If in any family issues there is no support, then they develop back pain. This you need to understand. This is psychosomatic. This is what we are coming up with. Psychic and somatic. Backache interlinked with the structure they damaged in the relationship, structure they damaged in their financial issues, structure they damaged in their relationship, structure they damaged with husband, wife, children, everything. That structure is damaged, then they develop this psychosomatic disease, the backache. That is a major of Kali. See some pictures here. Acute mania of Calibrome. Honor it stuck. Imagines he is being poisoned, pursued by demon. So Calibrum comes very close to stramonium. The insanity remedies, stramonium. Very sleeplessness, hated by everyone. strange imaginations. This all leads to suicide of Calibromatum. That's why Calibromatum developed lot of sexuality, lot of insanity you can see in Calibromatum. They suppressed these strange imagines, they develop acne. The pathology they develop is acne. Calibrom is one of the top remedy for acne if that is painless. What is the remedy of acne which is painful? Please do text in the chat box. Fast. The other remedy is Eugenia gembosa. Painless acne. Painful acne. This is painless acne. So these type of clinical tips we are coming with. Here you see Kali arsenicum. Kali, lot of anxiety, worries, care, family, dependence, along with arsenic. What is the main theme of arsenic? Very fastidious, very restless, fear at night, fear of alone, hypochondriacal patient, health issues. This is the gem. This is the core we are coming up with you. We have done a lot of work and collect a lot of information. We are coming up with you just to enlighten ourselves with very few amount. Please do join everyone. So coming to our main session, good evening everyone. Today's session is on case taking in homeopathy, and this PPT is prepared by our team. Thanks to my team. So homeopathy is an art as well as science. We all know science is systematic where art is imaginative. So understanding disease is a science and understanding man is an art. These tells you how we can in-depth interlink or in-depth go depth into the patient. This is what we need to understand. We never understand the pattern of the disease. We need to understand the pattern of the man in the disease. In the disease, how the man responds. For example, I am the patient, I have stomach ache, then I respond with lot of anxiety, lot of fear. Doctor, kya ho jayega? I have any cancer or my stomach is going any problem. Shall I go for scans? This is hypothetical. Fear, anxiety for health can be arsenic. Can be arsenic. Even the minute line what patient is about to speak is important. That is the art. In disease, you need to understand the man. Suppose if a patient comes and says, Doctor, I'm having joint pains. That is the disease or rheumatic arthritis. Now you ask how you feel the joint pains, what is your mental state, or how this pain is more and less, or when this pain and more and less. That is, you are directly entering into the point of man's art, the sufferings of the man in the disease, not concentrating on the disease. Then patient says, Doctor, this joint pain is very severe since many years. I cannot able to walk. I cannot able to do work due to this pain. Now lot of my pending work is lot of there. I cannot even work for many years. If patient is stressing on that, there is one rubric called mind delusion hindered work aid, only single remedy China. I'm not telling to give China, but you are getting an art that man is hindered at the disease, is hindered by some self, is hindered by the joint pains, cannot able to work, cannot able to do work, cannot able to do the things, cannot able to do anything. He is hindered, he is feeling. That is the delusion level. That is where the core lies. If a patient speaks stress on the same word for 10 times, 20 times while case taking, that is the hotspot of the case. That is where you need to dig. So there is a rubric. If you open from synthesis repertory, only single rubric, mind delusion hindered work at this China. Now try to interlink with China. For example, he could be a China. Then what cross questions you need to refer? Lot of weakness, loss of vital fluids, plans many but cannot perform. That's why they hindered. They say, I am hindered at work. That is China. Is it clear? Is it going well? Voice and screen is visible. Is slide is visible? Okay, thank you. Next, we have proper system to study about the disease, but to study the individual, we have to develop the art of interpreting his will and understanding to enter into the center of the man. Try to concentrate on the word center. The center. What is the center of the man? You need to understand. What he exactly feeling. What happened exactly. Like many people go into dig, like as I said, we come with joint pains and everyone asks aggravation, amelioration modalities, any concomitants, when it is more, when it is more. But you need to understand why this is started, when this is started, what happened before this scenario, either in mental level or either in physical level. If a patient says before that I have fallen, doctor, then all these complaints started, can be arnica as an intercurrent injury after. If a patient says, doctor, all these joint pains have been started after my disappointment of love, then you are narrowing the remedies. Can be nitromure, can be ignitia, can be staphysagria. Now you need to interlink who's the person. You need to interlink the center of nitromure. He could be the center of the nitromure, or he could be the center of ignitia, or he could be the center of staphysagria. That is the art. That is what I'm saying. Art of interpreting his will and understanding is in your capability. Every time when a patient comes and expresses the symptoms or chief complaints, try to ask when it started, why it started, what happened this 4 years back. Is there any scenario of mental or any scenario of physical injury, mental trauma? Try to dig from there. That is the core. Not just following the chief complaints, asking aggravation, amelioration modalities. You are going into rank pattern. Try to understand the person. The center of man you need to understand. The art of entering into the center of man lies in proper case watching. Rather than case taking, I say case watching. You need to watch the man who is in front of you, how he is behaving, what the pattern he is speaking, what the gestures he is giving. A true homeopathic physician should be like watchman, keeping a watch into each and every aspect of the case details without his own inputs and perception. That is prejudiced, which leads him to understand the very center of the individual, which truly reflects the man. So, case watching is not just enlisting the symptoms, not just writing aggravation by rising from sitting, amel by walking or resting. This is not enlisting the symptoms. You need to understand the man in it. The case taking, the case watching, you need to understand of a patient during sickness, but try to find a link between man and the disease. Fulford, that master prescriber recording as follows: case taking as commonly understood is thoroughly examining of patient from every possible angle that will give a deflect clue in the search for the indicated remedy. It is great problem with which the physician must contend and requires every atom of his integrity, skill, patience. For case properly taken is fully or half cured. The physician must be a good listener, very acute observer, and a past master in the art of cross questioning. See how beautifully he said. The physician must be a good listener. Try to understand what he is saying, and very acute observer. For example, if a patient is saying, doctor, I am having stomach pain, like gastritis problem, very much burning, while saying the patient is shaking his legs constantly, that is the acute observer. Restless in the feet, can be rustox, can be syncum. This is the beauty. This is the beauty. Not whenever you are about to take a case, try to interpret what remedy the patient falls from. Your mind has to run a different type of remedies in your mind. To understand, to run that mind, that remedies in your mind, you need to be a master of metaphysics. That is what the acute observer. If a patient comes and talks like guessing here and there, doctor, I went there, I hear that this is my pen, here showing gestures, mind gestures while speaking, that could be the one of the rubric in your totality. In your totality. If a patient is very mild, very commonly saying, very shy, can be Silesia, can be Barretta cup, can be pulsatilla. This is, these you need to understand. The acute observation is most important in case taking. Many people cannot observe, or many people don't see the view. If a patient comes into your cabin through walking or dragging legs, that is also the key confirmatory. Dragging legs. Or if a patient comes and this directly sits in the patient and falls like this, the weakness you can understand. If a patient of acute observer comes and says, doctor, I am having lot of cough, And okay, cough. When it is more, then he starts, doctor, it is morning, and like this only I cannot able to talk. Can be stanum met. Cough aggravated by talking with lot of weakness in the chest. Can be stanum met. Probable remedy can be stanum met. If the cough is so loud, can be high Alzheimer's. And ask the patient when your cough is more. Doctor, when I'm about to sleep, this cough starts very much, very much. In day, it is not that time, doctor, but in night, now it is so horrible. I cannot even sleep. Can be Drosera, touching the pillow, Rumex, all this. This is what you need to understand. This is we are going to teach very well. Is it clear? Is it going good? Please do it. Text in the chat box. Is everything is clear? Thank you. Thank you. He must see past master. We need to understand what is the past history of the patient. From there also we can get the information. Many students message me, doctor, I'm not able to collect information. Patient is saying physical generals are normal, just he's saying pain, but no pain at all. For example, you have dig the past history of mother or father, 5 generations from the mother side, 5 generations from the father side, or the past history of the person itself. If patient says, doctor, na, in my childhood I have recurrent cold and cough, very recurrent, every 1 month I used to get. Then you ask the mother, is it right? Yes, doctor, in childhood, na, every 1 month we used to go for hospital. Every time cold and cough. Why it is coming, we don't know. Can be tuberculinum. Frequent illness in children. The tubercular miasm can be there itself. The miasm you can rule out from the past history. He must know how to ask questions when necessary without any hint of suggestion of correct answer, and watch the patient every moment. If a child comes to you in your clinic and starts touching everything, your stethoscope or your books or your hand wash or your pens, desk, etc., mind alert at every moment, can be prosperous. The child could be prosperous. This is the indication without any case history. This you need to observe. This you need to observe. This is an art. No one tells it. You need to evolve or involve in such case taking. This all comes from the love towards your homeopathy, your system. Now, objects of case taking. The main object of homeopathic case taking is of course of recording faithfully the picture of suffering of each individual patient in such a way that the indications for simillimum emerge out of it. In taking case, we seek to recording details of sufferings of the patient, including the chief complaint, present symptomology, previous history, personal history, family history, along with abnormal findings on the physical examination and summary of previous treatments taken and their results. This is also important. Previous treatments taken and their results. If a patient has taken lot of steroids, and patient has developed AVN, avascular necrosis, what could be the remedy in homeopathy? Do text in the chat box. So the remedy is can be one of the probable remedy. I'm saying not that is the perfect remedy for that. The remedy is Angostura vera. Angostura vera works well in avascular necrosis. It is a mixture of ruta. It is a mixture of naxomica. It is a mixture of Merck salt. Angostura vera. Open clerk, you will find it, the comparison. This is the beauty of Metromedica. This is what we are about to teach in our paid sessions or in our free sessions also. We will be coming up with many free sessions as well. While taking the case, we have to remember that we may come across the most significant symptoms at any stage of case taking while listening to the patient. Like for example, if a patient comes and says, doctor, I'm very much worried my husband, he is drinking, he is alcoholic, that is only the major problem. Now you see, he is or she is stressing on that worry. Now you need to understand in what way you are worrying. What happen if your husband drinks? Doctor, now my husband is drinking with my money, he don't work at all, the whatever I am doing, the money is everything is going for his alcohol. how I can feed my children, how I can grow up my family. That is the worry. You just note down, not okay, the patient is worrying due to husband alcohol. But what is the state of her at the worry? That you need to understand. How she is worrying. Many people worry is different. How her worry you need to understand. This is the beauty. This is the beauty. Precautions during course taking. So what precautions we need to take? The very first precaution to observe before taking the case is to start with blank paper. The blank mindedness, which is easily convinced, then achieved. That is, we must be prejudiced. We must not be prejudiced. Should continue throughout the period of case taking. It is possible that first few symptoms of the patient may suggest the mind of the physician a particular remedy, but should not allow himself to be biased. Should think of remedies only after case taking has been completed. See, this is the beauty. Many people do this mistake. Like, for example, if a patient is saying, doctor, I am very much worried about my health. Chalo, go to the repertory, mind anxiety for health. Doctor, I am very much fear of ghost. Chalo, go to the repertory, mind fear of ghost. Then you repertorize, then in the sheet there is arsenic or there is staphysagria or there is nitromur, etc. Some other remedy. Now your mind is open for the few remedies. Now you start interpreting that this patient is nitromur or this patient is arsenic or this patient is so and so. That is where we do mistake. Never do repertory. Never do repertory. Never touch anything. Just note down the symptoms. Just note down the symptoms. Or try to understand the patient. See, watch him, what he is saying, in what way he or she is describing. Don't jump into the repertory or don't jump into the any metra medica or any remedy while telling few symptoms. That is where you go in a wrong. That is where we go and we say anxiety for health lot is there, then he can be arsenic. Then you ask doctor, then you ask patient, are you restless? Yes doctor, I am restless. Because he also seeks the same questions. Okay, doctor is asking restless, I could say yes, because if I say wrong, what could happen? Then you are prejudiced, then your remedy is prejudiced, you are going in a wrong track. This is not the art. This is not the art. Try to understand the patient very cautiously until he completes the case taking. Try to note down or try to record it, whatever the possible way you have. Don't jump into the repertory or don't jump into any remedy or metra medica. The essence you will lost. The precaution here is the essence of the patient you will be lost. Disease is an only alteration in the state of health of the individual, and this alteration is represented by symptoms. The physician must therefore ensure that all the symptoms recorded are actually part of the deviation from the original or normal state of the individual, and that's therefore form a part of disease picture. Right, this is beauty. Many people say, doctor, this patient or student is he giving his particular symptoms or he is giving any disease symptoms? This is common symptoms. So here comes the role of practice of medicine. You need to have a minimum or basic knowledge of each and every disease and their common symptoms. Sometimes patient may not describe anything. Sometimes we must select the remedy based on disease pattern. Like for example, I will say, if a patient comes with a grade 1 fatty liver, only the report, there is no symptoms, nothing at all, no pain, everything, and grade 1 fatty liver, and you ask for past history, two patients, one past history is alcoholic, other patient is non-alcoholic. Grade 1 fatty liver, grade 1 fatty liver. Now we should prescribe the remedy based on the disease, based on the report. Now tell me, what are the two remedies which can be given in grade 1 fatty liver with alcohol, without alcohol? Sure, it will work for sure. Tell the remedy. Tell fast. This is a beautiful clinical tip I am about to say right now. Guess the remedy. Okay, Cardus. Cardus is for non-alcoholic or alcoholic? Lycopodium naxomica, right? So if patient having grade 1 fatty liver, you are not finding anything. If patient is alcoholic, give cardasmar. If patient is non-alcoholic, he is chelidonium. Non-alcoholic grade 1 fatty liver is chelidonium. Alcoholic grade 1 fatty liver is cardasmar. This is the beauty of disease pattern. This you can get in Metra Medica. And tell the key confirmatory of chelidonium. How you can confirm chelidonium from physical generals. Key confirmatory of chelidonium. Chalo, do it fast. I'm here. I'm trying to interact with yourself. Okay, I'll tell the remedy. Chelidonium key confirmatories. Ask the patient how much hot tea you prefer. Doctor, my tea must be so much hot. It must be boiling like anything. That is chelidonium. Boiled tea desire. Only single remedy chelidonium. And another key confirmatory is scapula pain. Exactly scapula pain. That is chelidonium. What if chelidonium fails? What if chelidonium fails? Say you have given chelidonium and it's the right remedy, but partial improvement. What is the tell? What tell the next remedy? Comes very close to chelidonium. Lycopodium. If chelidonium fails to act, you can think of lycopodium. It was given in Fatak. And the other remedy you can think of rare remedy Yucca filamentosa. Yucca filamentosa from boric. Same like chelidonium. Comes very close to chelidonium. Comes very close to Noxomica. Bilious symptoms with headache. Chelidonium. The rare remedy is Yucca filamentosa. YUCCA. Yucca filamentosa. So this was prepared by myself. The rule of 6 in case taking. What are the 6 rules we need to evolve or involve or we can have in our case taking? First is to observe, to listen, to write, to question, to examine, to coordinate, to question in the sideways, to question at a proper point is necessary. For example, if a patient is saying very seriously about his past history and you just interrupt, then he immediately forgets what he's about to say. The essence is missed. So at proper time you need to question. If a patient is going some other way, like loquacity that is very much unrelated to for herself, stop there itself. Ask them, come to the point. At that time you can question. That is where the loquacity you can see there. To observe without saying a single word, but with the eyes wide open to notice the gait, behavior, gestures, the smallest change of expression. I will say one beautiful example. I have a patient who is having liver problem, and he came and he sit into my clinic and he says, doctor, see, I have here problem, very much problem here, liver problem, and he is rubbing like this. I asked, why are you rubbing? Doctor, if I rub now, it feels better. Now, what is the remedy? Immediately, I prescribe the remedy. Within 3 or 4 days, patient is very well. Tell the remedy what I have given. Do it fast, please. Yes, one doctor has said right. Congratulations. The remedy is podophyllum. Podophyllum. Liver complaints, rubbing amel. Single remedy podo. To listen all the noises, respiratory, digestive, articular, etc. And of course, listen without interpreting. If patient talks, let him do so freely. Otherwise, he will reproach you for not having been able to utter a single word or at end of consultation. He will come out with a long array of symptoms written in his notebook. Put him off until tomorrow if necessary. But let him talk. First, because to listen is a sign of politeness, and besides, you will let him do the extraversion so preached by psychoanalysts. To be able to narrate one element and feel that somebody is listening with interest and benevolence. Benevolence. Coffee cruda. Be coffee cruda. And constitutes a great relief, you know that. So whatever patient narrates, very patiently listen. Listen. Understand what he is saying, why he is saying, what is the core, the hotspot from where this suffering has started. That will tell you the way patient narrates the symptoms. To write and in the exact terms of talker in order to able to later on to recollect his own personal experience. To question, what to question? During the process of questioning, the physician should pose only such questions which are not leading in nature. Those that do not suggest any answer. Like for you ask, patient, do you like sweets or not? Yes or no? Patient says leading questions. Doctor is asking now, so I must say yes. If I say no, again, what could be the problem? Yes, doctor, I like. This is leading questions. You must ask what type of sweets you like. Like for example, in a plate, if someone gives you some warm sweets or some cold sweets, gulab jam or etc., what you will take? Patient say, no, no, doctor, I never like cold sweets at all. I don't touch it. I like warm sweets which are hot. The remedy is lycopodium. That is indicating lycopodium. Desire warm sweets. Read boric, bold letters it is written. Now, how to confirm lycopodium in case taking? Immediately, what I do in my clinical practice is, if patient is about to desire warm sweets, immediately I ask, does your heel cracks anytime? Show your heels. Patient shows the heels and it is cracked. Chalo, he is lycopodium. For sure, he is lycopodium. Heel cracks, warm sweets, he is lycopodium. He is lycopodium. This is the beauty. This is the observation. This is the art. To understand, you must master Mathemedica. You must master Mathemedica. Questions may suggest only the type of answer required. Leading questions may bring forth misleading answers. The patient sometimes give the answer which he thinks and the physician wants for him. This is, we must not do that. Like now I give an example of desired sweets. If a patient has aversion to sweets and having chief complaints of involuntary urination, what could be the probable remedy? Chalo, text in the chat box. Do it fast. Fast. If a patient having aversion to sweets and having involuntary urination, yes, causticum, that could be the remedy. See how a physical general is ruling your remedy. Like for example, if a patient comes with same involuntary urination, I could ask this question coming to physical generals, because physical generals are the generals where patient never lie. That is the core. That is the core. And if a patient tells doctor, doctor, due to cold milk now I get lot of diarrhea, I cannot able to drink milk, especially cold milk, what is the remedy? Chalo, please do involve, do it fast please. What is the remedy? Cold milk diarrhea. Iodine, nitrum carb, Cipia. Right, good. Some doctor has confirmed the remedy is Cipia. Cold milk diarrhea is Cipia. And cold and milk desire, very much milk desire is Rustox. If a patient is of Rustox, his constitution is Rustox, the main prominent symptom I ask is, do you drink milk? No, no, I doctor, I am very much fond of milk. Rustox. Cold milk diarrhea, Cipia. Warm sweets lycopodium. Aversion to sweets can be causticum with involuntary urination. This is the beauty. This is the beauty. This is what I want to teach you all. Evolve. Let's all evolve each other. For instance, we should never ask, are you thirsty? But only inquire, how much water do you take? This is you need to ask. Suppose, doctor, I will take at least 2 or 3 liters. Okay. Now, what I do in my practice, this is what I'm saying. I usually do in my practice, I'm putting in front of you with lot of wholeheartedness. I ask, suppose if I give you a cup of water, how you drink? Do you drink sip by sip or you swallow up whole? Patient says, no, no, doctor, I drink sip by sip. Okay, he can be arsenic. Can be arsenic. The remedies you need to run. If a patient saying, do you drink water? No, no, doctor, I don't have any, like, I don't feel like having drinking water. Thirstless. Can be pulsatilla. Can be arsenic. In chronic cases, arsenic is thirstless. In cases the patient doesn't follow any question and finds it too vague, a more specific and even slightly leading questions can be put, but a number of alternatives should be placed before him. Example, what kind of pain do you suffer from? Is it burning, pressing, pricking, shooting, stitching, tearing? This is beauty. If patient says stitching pain, lot of stitching pain, doctor, can be kalis, can be kalisals. Almost all kalisals have this stitching type of pain. Can be burning pains, can be epis, can be sulfur. Shooting pains, tearing pains. You need to put direct leading questions by giving 3 or 4 options, not giving just one option. What Boger has to do is this. Master Boger. We may ask, what food or drink do you desire? And this is what desires and aversions. How I confirm in my patient or in my clinic is, like for example, if I give you a plate and in that you have sweets, salt, and sour items, what could you pick up? Patients say, I pick up salt, salty items. Okay. Do you use extra salt while eating? Yes, doctor, always I will pour extra salt on food. Okay, okay. Can be nitramure. And if a patient I ask fruits, okay, what kind of fruits you eat? Doctor, I have a lot of desire for fruits. Then we generally write desire for fruits. Chalo ho gaya. But you need to ask what kind of fruits you desire for. Patient says, doctor, I desire for watermelon, oranges, especially green fruits. I like so much of green fruits, guava or green oranges or watermelons. That is the indication of sure short medorinum. Sure short medorinum. Green fruits desire, especially patients saying of watermelon or oranges or cucumbers, for sure he or she is meadow. He or she is meadow. If you open any repertory, green fruits desire medorin is the top remedy. Top remedy. And if a patient comes and says, you use lot of desires, doctor, I like pizza, burger, pani puri, whatever you keep now, I like eating. I like eating so much. I don't have any aversion it. I like so much of eating. Whatever you give, I eat. Can be meadow. In Metre Medica, medorinum has around 150 of cravings. 150 plus cravings. That is the genius of medorinum. And now with this, you need to confirm in which position you sleep. I immediately jump into this confirmatory symptom of meadow because that is a strong indication of that remedy. And I ask in which position you sleep, you feel comfortable. Position means what, doctor? He says, then we need to give some leading questions. Either you sleep on right, back, or straight, or abdomen. How you sleep? On stomach. Doctor, I sleep on stomach. On my belly, I feel very much relaxed. Sleeps on abdomen, medorinum, with desires matching. For sure, he is medo. And now go into past history. Now dig the past history. Doctor, patient, do you have any urinary tract infection? Doctor, I have urinary tract infection very long time. How you know? This is the art. For sure, he or she is medorinum. For sure, for sure. Is it clear? Is it going good? Here I'm not only concentrating on the case taking, but I am giving you a lot of gist how you can proceed through Metromedica and case taking. Is it going well? Thank you. Thank you. Yes, thank you. You are very, very active. I'm very happy for that. In which position do you find relief from pain? Or may I ask, do you crave any particular items, food such as sweet, sour, salty foods, milk and eggs, etc.? And you see, whenever you come to particularly these desires and cravings, if she is a female, try to ask during menses, before menses, do you have any special cravings? That is also odd. And my dear colleagues and all my friends who joined here, never look for something everyone is looking for. Look for something where no one has looked. Then you will master homeopathy. I hope you understand this line. Look for something where no one yet to be viewed. That is the beauty. That is the beauty of homeopathy. Try to look the oddest behavior. Try to look the odd symptom. Try to confirm what is odd in the patient. Then you will success. Not looking everyone looking from the same point of view. That is not. That is not. Try to look a odd one out. Think out of the box. That is the beauty of homeopathy. Points to remember. Advise the patient. I'll go some fast. Where it is necessary, I'll concentrate it. Advise the patient and narrates and our attendants to speak slowly to write down what the patient says and narrates. Let the patient talk, as I said, and the physician should listen and write down accurately. Listening is most important. And three mistakes in taking histories: interpretation, yes and no answers, the leading questions you need to ask, confirming the remedy you want, that is pet remedy. This is what many people do mistake. Even I do in sometimes. This we must not do. Confirming the remedy which you want. Confirm the remedy which the patient want. That is the beauty. Direct and suggested questions are most dangerous to confirm the remedy. Let the patient tell you, write your artful interrogation. Keep silence and refrain from interpreting the patient unless the patient wanders too off to other matters. As I said before, when the patient is speaking unwanted matter, he's speaking something, my sister doing that job, doctor, he is MBA, she is MBA, my son is police. That is not necessary for us. Try to break there. Ask the patient to come into the case taking pattern. What is important, what is hotspot of the case. Record the intensity of symptoms while taking the case. This line I will tell you. What is intensity of symptoms? What is that intensified? For example, if a patient says, doctor, na, with this pain, I am suffering a lot. I feel I cannot walk tomorrow. I feel my future is gone. Oh, kya ho gaya? Why you are feeling that? No, doctor, this pain, see, I cannot able to walk from many years. I have taken that treatment, this treatment, XYZ, but no improvement. Okay. Now what you are feeling? I am feeling that my leg will be cut down. Maybe I cannot walk in lifetime. See the anxiety, that is the intensity of symptom. That is where the core is lied. I'm explaining the psychosomatic. The patient feeling I may be paralyzed, I cannot walk. Mind despair from recovery can be sore in them. This is the mind rubric. And if a patient says intensity of symptom in a physical level, doctor, this pain is so much now. Whenever I am about to stand, I cannot able to stand. Standing is the biggest problem for me. Please, doctor, I cannot stand. Do anything for me, please. Such with this standing only, I am getting pain. While sitting now, no problem, doctor. I am very much relieved. Okay. How is this pain for you? Doctor, this pain is like so much of burning, like fire. Burning pain, standing aggravation, sulfur. See how beauty. And that is the intensity of symptoms. Concentrating on the intensity of symptom is most important. How the patient expresses. An intensified particular symptom will necessarily be a rated higher than a general symptom with poor intensity. Right? For example, see, one strong general symptom will overrule any number of particulars. Strong general symptom. Now, as I said before, the medorinum. Strong general symptom of medorinum. Rule out any particular disease. If you find strong general symptom without confirming any pathology, can be given sometimes. Will help for sure. I have seen the cases from my gurus and in my practice as well. That is what the strong general symptom will do you in your case. Select and choose your questions well to fit the situation when interrogation the patient. Your aim should be make the patient feels free so that he tells you everything. Interestingly, one doctor has asked, doctor, in the first setup, how we can get mental symptoms? This is what? Make the patient feel free. Ask the patient to tell everything. The first major question you need to, what I do in my place, whatever you are suffering, please tell very clearly. I will help you for sure. If you hide, we cannot help you. This is the main motto we need to give the patient. First, we need to give the patient some knowledge or education what we are about to do, and ask them. See, we will ask this about this of symptoms. We'll ask what food you like. We'll ask what kind of food you like, how you sleep. So these all are important. Try to explain very clearly for me. I am here to help you. Make the patient feel comfortable. This is we need today. Directly patient coming into your clinic. हाँ चलो क्या problem है आपका? First, ask them to educate because they don't know what is homeopathy. They don't know the case of homeopathy, the case taking of homeopathy. Please tell them, explain them. Use some time. Make patient feel comfortable. This is in your hands, not in any books. Totality is the king. Location, sensation, modalities, concomitants. LSMC. This is the king for any case. Next coming the side modalities, the time modalities. And here side, see, many people say, doctor, like for example, I tell you, frozen shoulder, rheumatism of frozen shoulder, patient complaining of right shoulder, left shoulder, but it is matching completely of Sankan symptoms. Now, Sankan is right-sided remedy, but the patient is suffering is left-sided. Can we give? Yes, you can give. We are matching the totality. We are matching the totality. Sometimes sides can be ruled out because the general symptom or particular symptom is matching. Sankan is of right-sided rheumatic shoulder. Ferramate is of both right and left. Time modalities. This also you need to understand. Almost all Kalis, as I am about to say about Kali, at 3 a.m. aggravation is Kali. Evening aggravation is lycopodium. Evening aggravation is lycopodium. Modalities, extension, from where to where pain is going, how it is extended. You need to ask for the patient, is that pain is at one place or it will go somewhere? No, doctor, it starts from here. No, it will change to here and it will come to here and it will go to here. Sometimes it will be in the right hand. Sometimes it will be in the left hand. Sometimes it will be in the leg. Wherever I don't know, doctor, the pain will be shifting, constantly shifting. Pulsatilla. This is the role of extension. Changing of symptoms can be lac canonum. How beauty, how beauty. Everything is in our hands. We are not able to use it. I am here to tell you how to use it in your practice. Character, what type of character? If pain is involved, its quantity or its severity, how bad is it? That is what. And this tells you how your prescription should be. For example, if a patient having severity of pain and you tell to take daily, you take 3 times a day, come after a week. That is not. Ask the patient to take immediately frequent repetition. What I do in my clinic is immediate relief I give within 5 to 10 minutes of water dose. I ask the patient to take for every 5 minutes, every 10 minutes, every 15 minutes, every 1 hour, every half an hour, every 1 hour, and ask the patient to follow up. Sometimes I give the remedy, ask the patient to take from tomorrow you start, whenever you about to get up and whenever you sleep, take 1 cap. Every day, 1 hourly, 1 cap. Day two, 3 hour, 2 hourly, 2 caps. 1 cap, sorry. Day three, 3 hourly, 1 cap. See, the hour is changing, the day is changing. Within 3 days, patient will get the relief. Why? This is acutes, deal acutes. Based on severity, choose your dosage. Based on severity, choose your potency. Now, instructions and questionnaire. Physician should inquire about the patient's mental state and his likes and dislikes. In the course of the interview, you often identify clues, emotional and other psychiatric problems. Sometimes the psychological history suggests some contributory factors of the patient's illness, mechanism, strength, and concern. So here nothing but you should be very careful in handling human heart and human beings. This is what I want to say. We are not handling the disease or we are not handling any particular pathology. We are handling humans heart and human beings. Keep this in mind. This you need to understand. We are handling human hearts and human beings. So to handle a human heart or to handle a human beings, how carefully you need to interrogate or how carefully you need to understand the man is important. Keep this line in your mind and you evolve yourself. Now, avoiding all leading or direct questions. Do you like sweet or sour? Do you cough at night or day? Is your leukorrhea white or yellow? This you need to ask. What type of sweets you like? What type of sour food you like? When is your cough? Is your cough is it daytime is more, nighttime is more, afternoon is more? And how is your leukorrhea? How is your offensive smell of leukorrhea? This you need to ask. Not just is it white or yellow, night or day. That is not. The leading questions should be avoided. Now, what are the greatest griefs that you have gone through in your life? See these questions I framed for you. You need to ask, like, for example, patient is of more of mentally disturbed, having depression. Then you start. What are the greatest griefs that you have gone through your life? I usually ask this in any case. At the end of the case, I ask, like, like patient, is there any stress or is there any tensions or is there any situation or condition that made a huge impact in your life? Then patient says, doctor, na, after my father's death, na, I am unable to cope up. Maybe this could be the reason why I developed all these symptoms. The causation you will get there. The causation you will get there. See, after whole case taking, you need to ask, or you need to ask in the middle itself, what is the major stress or in your life which made a huge impact? They will describe you. Now some doctor has said how we can get these mental symptoms at first sit up. This is the beauty. Ask them for sure they'll give. Ask them what is the huge in your life which made you a huge impact that has changed your life drastically. Ah, doctor, I will say in my childhood now, one teacher is there now. She used to scold me like anything. I cannot able to express myself to my parents or my children. I am much very much suppressed, a lot of suppression from there on itself. Afterwards, my mother also now used to scold. They don't even to listen me. I used to suppress all these emotions, and he is coming with skin complaints. The remedy staff is agree. Emotion suppressed, anger suppressed. This is the beauty. Patient cannot open up until you frame a proper question in front of you. Is it clear? Are you understanding what type of questions to be framed? Is everything going clear? Please do text in the chat box. Yes. Thank you. Quite often, the patient will lower the head and look mood, and a kind of word of the doctor will be needed. It is why as soon as the extra version or self-expression has been made, this following question which make the patient look at you again in astonished way and sometimes with a happy smile. And this I will explain you very clearly, very clearly. Watch me, watch my video. Like for example, if a patient you are asking, what happened in your life? What major stress happened? I think you are suffering with some depression. That is why all this has started. Whenever you are about to ask and patients cannot speak for a while, patient has stuck. Patient has stuck to speak. That is where the core is lied, my dear colleagues and friends. That is the core because patient has understood that you are catching the main point, and patient has struck because his emotions are about to express. He will stuck for a while, and then he starts speaking. Doctor, this is happened. This happened. That happened. The struck feeling and the patient about to speak will come from wholeheartedness. That is the core. That is where the genius of the patient is live. You need to understand. Here, what are the greatest joys you had in your life? How did you stand worries? How you cope up your worries? If a patient says, how doctor, my worries, I know it will be like everything, everyone has these worries, but I cope up is in my positive manner because of my positive attitude. Na? I cope up, no problem with that. I don't take it, everything I take it light because I have that knowledge or I have that, what I can say, to handle all these situations. I'm very well what with all these situations I have seen. Philosophical mania can be sulfur and worries. Ah, doctor, I am worried with lot of how this will be happen, what will be happen, and how my family will be getting on. Doctor, I am the only one person in my family. I am only one. I am earning. How this worries? How my children will be worried, and my relatives also. They are also having problems. My grandfather also, my mother also having problems. I am the only one doctor in my family. How these worries are so much? Causticum. Care worries for others, care worries for children, care worries for others, anxiety for others. Causticum. This is the core. This is the core. Not just concentrating on worries. Try to understand who is the patient in worry. I think I am expressing my wholeheartedness here for you. If the patient cannot answer, we will just ask, not losing for 1 second his expression with music or reproaches, or which time on day. Certain people can refrain from weeping and some others cannot. I usually ask, if you get weeping, do you cry alone or you cry in front of everyone? No, no, doctor, I cry alone. Can be nitramure. No, no, doctor, I cry in front of everyone. What is there in that? Pulsatilla, open-mindedness, extroverted, prosperous. I cannot cry, doctor. Even if my father, my grandfather died now, I cannot even single weep. I cannot weep. Can be nitramure. They suppressed the reserved emotions. They bottle up their emotions. This is the indication. See how beauty I am here teaching you. Through worries, how we can select the remedy. Through weeping, how we can select the remedy. Through grief, how we can select the remedy. Expressing my wholeheartedness for you all. At what time in 24 hours do you feel blueness, depressed, sad? Doctor, now at evening time now I feel so much of gloomy. All my emotions I feel it will come at evening time only. In daytime now I'll be very free. My mind is free. But at evening time now, then I start worrying about my emotions. I feel sad, depressed. Arey kya ho jayega? Kyun ho jayega? I feel crying. Now you go into repertory. Mind twilight aggravation. Twilight aggravation. Calcaria ka, phosphorus ignitia. Top remedies. Top remedies. This is the beauty. And some patient says, doctor, na, I get depressed exactly after midnight. At 9 o'clock, about I go to sleep, I get depressed, and immediately I open phone and I talk to my friend. Are aisa ho gaya, aisa ho gaya. Then I feel better. Rush talks. Mind midnight aggravation at 12 a.m. or 12 p.m. Midnight aggravation is rush talks. This is beauty. From time modalities, you are picking the remedy. In time of depression, how do you look at death? You fear of death or you suicide? That is you need to ask. Certain patients have persistence of death through the death, even desire to die. Others have tendencies, desire to suicide. So all this you need to ask. What effects have consolation on you? Consolation, I feel much better, Dr. Palsatilla. Consolation, aggravation, nitramure. So I'll go little further. On what occasions do you feel despair? As I said before, I am very much despair this due to these pains, doctor. I think I cannot recover from that. Despair from recovery of pains. In what circumstances you have ever felt jealous? Jealous, doctor. If someone in my class, like Sai, that boy is getting first rank means I'm so much of jealous, doctor. I need to get first rank. I must show what I am. Naksomika, competition, jealous, ambition, desire for. In women's also they have jealous to other women. Epis, women's jealous is epis. See the pattern. In jealous, what kind of jealous is important. In anxious, what kind of anxious they are feeling. Try to understand the core of each word what patient is about to express in your clinic. As I said, be a lot of detective like kind of nature. Try to see what he is, what she is doing, what he is doing, how she is saying the symptoms with gestures. If someone says like poem way, in a singing way, they are about to talk. Restless, very cautious and tactful. You need to be so much of cautious and tactful. This already I have explained. That's the reason why I'm going very fast. Now, we should also inquire into treatment which was taken by patient previously and gain the knowledge of their any symptoms due to drugs previously used. This is you need to understand. In every case, dietary and chemical contact of investigation. The occupation you also understand. If patient works in any factory, chemical factory, that is where the problem starts. Obstacles in a way of recovery must be removed. Hahnemann writes if finally he knows the obstacles to recovery in each case and is aware how to remove them so that the restoration may be permanent. See, many people go here. This is what I need to concentrate on more. Doctor, I have given right remedy, but patient is feeling better for a few days, then again same complaint started. अरे क्या हो जाएगा? Our remedy is right, but again the same complaint started. Again you have given the same potency or increase the potency. Patient is feeling better. Again the same complaints, obstacles for cure हो जाएगा. Again same complaints recovered. This you need to understand. This is what are obstacles. Then you need to ask the patient what your occupation, how your occupation, what type of food you are taking. If you need to understand obstacles for cure very good. Try to read Stuart Class Philosophy, Obstacles of Cure lesson, where he has mentioned obstacles for physician, obstacles for remedy, obstacles from the patient as well. There are three types of obstacles: from the patient, from the physician, from the remedy. Try to read, and I hope those who have read they can send me the notes in WhatsApp. I will give you a gift of PDF of some good book. A point of utmost importance when a patient says, Doctor, I have never been well since. This is the beauty. This you need to understand. What is this never been well since? Doctor, now after having burns now, I am not the person saying causticum, never been well since causticum, never been well since asthma, phosphorus, never been well since like tuberculosis or any other respiratory illness, can be bacillinum, can be tuberculinum. This you need to understand. This comes in the past history itself. Never been well since. And this is not only for the pathological or a physical sphere. This can be into the mental sphere as well. Doctor, after my marriage I am not the person same. Elements after marriage. Or you can say elements after separation. If she is a woman, then that woman has to travel for 1,000 kilometers from their mother and father. She has to stay with his husband and there is no meetup, there is long gap. Then patient describes after marriage I am not the same person. Kya ho jayega? My father mother is so much far, doctor. Now I am not able to live the life which I have been. I having some problems. Elements from suppression. Again comes Kali Sal's here. This you need to understand. This never been well things will unlock you many chronic diseases. Many chronic diseases. Now, cause, predisposition, and exciting. This you need to understand. What is the exciting factor going on? What is the predisposition factor going on? In acute cases, try to concentrate on predisposing and exciting process. In chronic cases also, predisposing is most important. And after the follow-up, if a patient comes with new complaints, then you concentrate on the exciting cause. Exciting cause. And I will tell you beautiful tip here. For example, you are treating a chronic case and patient is pulsatilla, you have prescribed pulsatilla and he come with some acutes. And in acute, he is not able to tell the symptoms at all. You can give pulsatilla because his constitution is pulsatilla. Pulsatilla will help the acutes as well. This you need to understand. If there is any particular symptoms you find out there, then you can prescribe your acute remedy. Once that acute is settled down, then continue with the chronic remedy or the constitutional remedy of the patient. Physicians has to remember 4 W's. These you need. What? Symptom and sensation. Why? Causation and situation. Where? Location. When? Aggravation, ambulation. What? Why? Where? When? This chart you need to remember. Is it clear? Thank you. Now, this is beautiful. Coming into observation, we'll go so fast. The 5 sense and the 6 sense, which is common sense, are marvelous instruments of perception. See how. Look around the room. Notice the dish of cracked eyes on the stand beside the patient's bed. Can be medorinum and phosphorus. Desire for eyes. And interestingly, from Phatak repertory, if you open Phatak repertory, in pains, the desire for eyes only remedy medorinum. During pains, medorinum patient desire eyes. Phosphorus also desire cold things, cold ice creams, cold drinks. And phosphorus cannot lie on left-sided. That is the key confirmatory of phosphorus. Medorinum lies on the abdomen, past history of UTI, lot of laziness you can see, and they desire for onions and aversion for onions. Medorinum and Tuja comes very close to each other. The main differentiation is amelioration and aggravation of C-side and 5am aggravation and amelioration. Medo and Tuja. And anticipatory anxiety in Medo is seen same like argentum nitricum and gelsemium. Same like argentum nitricum and gelsemium. In argentum nitricum, the anticipatory anxiety is with lot of restless. With gelsemium, the anticipatory anxiety is lot of dullness. Open windows and cold night in winter. Open air amel, pulsatilla. Patient wants to be fanned because he wants the air moving so that he can breathe faster. Can be carbovage. This you need to observe. Bump against the bed and jar of the patient, you will doubtless hear from him. Can be arnica, belladonna, bryonia, or noxomica. Injury. You can hear the breathing all over the room with rattling as if the chest were full of bumping mucus in a young child or old person. Can be anti-inflammatory. Tell me the remedy. Chronic bronchiectasis with wheezing in adult is anti-inflammatory. What is the remedy in old age? Old age anti-inflammatory. Chalo, do it fast. Do it fast. Nitrum sulf, meadow, okay. The old age antium is hippozinum. Hippozinum. And the other remedy you can think of is ammoniacum. Try to open boric metromedica, ammoniacum, chronic bronchiectasis in old age. Hippozinum and ammoniacum are the remedies. Next, on entering the room, a strong decayed odor greeted with can be arsenic, pyrogenum, and sorinum. Very offensiveness, very much offensiveness. If this is offensiveness in a child, what is the remedy? Offensiveness in the child, the body is offensiveness, the stool is offensiveness. Tell the two major remedies here. Chiro, do it first. Good. Room, yes, room and makeup. Room and makeup. Patient have fever every afternoon from 4 o'clock to 8 to night, 8 or an evening aggravation, lycopodium. There is very septic temperature curve with no relation between pulse rate or temperature. Think of pyrogenum. And interestingly, pyrogenum is the remedy you can give in emergency cases or in ICU cases where patient tells doctor, I'm taking a lot of paracetamols, but the fever is not coming down. It is in the peaks. 103, 104. Give pyrogenum. Frequent doses. It will help a lot. Now coming into inspection. Hemoptysis. Hemoptysis after repeated mental shocks was cured by ignitia. Mental shock is ignitia. Indifferent attitude of a woman who had typhoid cure by sepia. See this, the psychosomatic everyone is catching. These are the cases which I picked from the stalwarts and the sentence I just framed here. A woman after childbirth had lavicious mania, was cured with hyoscyamus. And Alzheimer's having more sexual desire, but phosphorus is more sexual desire than Alzheimer's. This you need to keep in mind. Alzheimer's and phosphorus. Urination unknowingly woman was cured by causticum. A talkative woman during menopause who made her husband half manic was cured by lacosis. Menopausal syndrome. And interestingly, lacosis is the one of the top remedy everyone think of in menopausal syndrome or in menopausal stage. The other remedies we can think of is Sancan, works very well. I did a beautiful case with Sancan of menopausal symptoms. The other remedy is glonanine. This also works well. Glonanine, Sancan, and lacosis. An obstinate child who made shows in public and made mother cry was cured by tuberculinum. Very obstinate. If Cilicia was given failed, then can think of tuberculinum. Obstinate child. Headstrong child. Palpitation. Fear of being touched or approached. This is see, while you are touching patient, oh doctor, doctor, don't touch, please, please, please. Fear of being touched, feels that something could happen. Arnica in case of acute rheumatism. An interesting point I will say you. How to confirm arnica? Head is hot and extremities are cold. You just touch like this, like this. You just examine if it is hot, coming down, coming down. It is cool. He is arnica. That is the Montana sign which I learned from my guru. Sore to touch, but better by movements and rubbing, giving indication of rust ox. Hot swelling, which aggravated by touch movement, but pressure relieved, can be bryonia in case of acute sinusitis of right knee. A touch on kidney region with oversensitiveness led to give solid aggo. See this beauty. Try to watch out. Try to watch out what patient is doing in front of you. Dullness at right upper lobe of lung in a case of pneumonia with aggravation at 4 a.m. was given lycopodium and case was cured. This was observed in 36 cases of pneumonia. This was taken from stalwarts cases, I am saying. Dullness at right upper lobe and right middle lobe diagnosed as double pneumonia along with their other modalities was cured by phosphorus. So while examination also you will understand what is the remedy. That much precision, that much intelligent art you need to understand. Shifting dullness in right sided in case of acute pleurisy with effusion was prescribed bryonia and it was cured. In Allen's you will see if you read abrotinum comparison this was written like acute pleurisy. Now auscultation. As I said, rattling sound is anti-emetic. Cough as if saw is driven during inspiration with expectoration can be spongia. Bubbling rails with full of mucus but does not come out with wheezing led to give ipecac in bronchial asthma. So don't forget about physical examination of the patient. Patient does not get satisfaction during and after examination. That is the great beginning for cure. So immediately whenever patient comes in front of you, try to touch him. Try to make the patient feel comfortable that you are examining him, that you are concentrating on him or her. Try to check their BP. Ask them to try for weight. Come near you. Try to interact with the patient. Take their hand, examine, check their tongue, check their nails. All these are indications. Now, how to analyze pain? This is very important as there were various kinds of pain such as cutting, boring, digging, paralytic jerking. This is what I said before. Give the exact location on the head, body, arms, hands, legs, feet. Either it is right side or left side. This is location. State whether the pain is remaining in one place or shifting. Can be pulsating or shifting pain. At constant pain is ipecac. If a patient comes and says, doctor, I have pain, exactly, see, here, exactly on the spot, doctor, on the spot. Now, here only I'll get pain. Pain on the spot is ignitia and kali, bichromicum. Spot like pains, exactly on that spot itself. This is the beauty. That's why I ask them to ask the patient, is the pain is extending or it is staying at the one place? And in pain, how the patient feels, how this pain is affecting you. As I said previously, delusion hindered work at China is the remedy. How mentally you are affecting due to this pain. Doctor, due to this pain, now my case, severe pain, I am thinking better to die only. That much of pain I am getting, doctor. Death desired during pains can be aurum. So what is your general feel? Try to take screenshots of this. That will be helpful for you. What is your general feeling after the pain leaves? How does pain comes quickly or slowly? Anything that seems to bring it on? What does the pain leaves? What kind of pain is it? So these you need to ask questions. This is for you. I just added. Just take screenshots itself. I'm about to move the slides because this already I have explained very clearly. I just added for your sake just to take a screenshots and keep in your clinic while answering. I'll just come back again. Please do take it very soon. Do it fast. Now, case taking and acutes. Any obvious percepting cause such as injury, fright, chill, whether the illness develops slowly or gradually, this is important, as I said before. For instance, it may be difficult to distinguish between gelsemium and bapticia say in influenza. Gelsemium tends to slowly develop acute illness, where bapticia is the onset is very sudden. This you need to understand. If a patient comes and says, "Doctor, my fever is suddenly picked up, sudden change, aconite can be bapticia. My symptoms are very slow, pace." As I previously said about case taking, the pace is important to select the remedy. Its nature, if present or absence about thirst. Thirst is normal, present in fever, and it is not therefore any value unless if something which is really definite. Thirst for sips of hot drinks is characteristic of arsenic. Thirst for cold drinks, usually in children, if the child wants warm drinks, this is specular syndrome. And this is what see. How we can many people say, doctor, now child asking chocolates, that we can consider as particular symptom or general symptom. That is general symptom because every child craves to have chocolates. Every child have craves to have cold drinks, but once the intensified is there, like intensified, mother says, doctor, now my child, every time he asking chocolate. If I don't give chocolate, then this person become cranky, restless, anger, tarantula, destructive. That is intensified. That is that at the time that is particular. This you need to differentiate. This you need to understand. This comes from the age. What the patient in front of you. Suppose if a old age patient comes and says, "Doctor, I crave chocolate now. If I don't have chocolate, I feel like I don't have. I feel like I don't. I feel like this life is not. I want chocolate. That's it." Old age it is peculiar, but a child asking chocolate is not peculiar. A child asking for cold drinks is not a peculiar until and unless it is intensified. Child really wanting warm drinks usually require arsenic or lycopodium, but the remedy should never be prescribed on one symptom, and other symptoms must present, such as restlessness and fear, especially around night, midnight, fear of death, which is often confirmed the arsenic. This is what I said before. Try to interlink. See, for example, as many female homeopaths joined here, they know the beauty of having this art, or what I can say, they have that mugu in front of their homes. They keep dots, and they connect all the dots. Then it become a beautiful picture. If they are trying to connect the dot of one and two, they cannot get the beautiful picture what they are expecting. So that is what I want to say. Never prescribe remedy on one single dot. Try to gather the thread of the dot and make a beautiful picture of arsenic or lycopodium or rust ox or whatever. Connect the dots, not just prescribing on single dot itself or not just prescribing on single symptom. Other symptoms may confirm lycopodium. Modalities, as I said before, modalities plays a crucial role. Concomitants, this is beauty. Now, for every symptom, you need to understand, every complaint, you need to ask for any concomitants if patient have. The concomitants either should be in the mental level or physical level, right? That you need to understand. Past history, as I have clearly, detailedly explained about past history. Importance of past history. If psychosomatic prescription fails to produce satisfactory results, the past history may lead to an appropriate remedy for that individual. Alternatively, it may be advisable to prescribe on a family or individual history when there is no clear symptomatic indications, as I said before, for any one remedy right from the beginning. If there is diabetes in the family history can be made, or and informally, almost all past history will suit to no sorts. No sorts. Not well sinks, I already explained about this. That not well sinks can be from acute infection, can be from injury. This you need to dig. Can be from psychic factor, can be from drugs, can be from anesthetic history, can be from other factors. For example, patient have operated for hysterectomy. Then the patient developed pains, weakness, or constipation. The remedy is staphysagria. Not well sinks after operation or surgery. Staph is one of the prominent remedy. Family history, I have dealt. Generals, I clearly dealt about generals. Once again, I'll just very soon. Sleep position, like as I said before, the other sleep position you need to ask in the patient is, while sleeping, you cover bed sheet, and if you cover bed sheet, the legs will be inside or outside. If it is outside, there are only three remedies in Metra Medica plays a crucial role: sulfur, chamomilla, and medulla. Legs keeping outside, sweating on particular parts. Ask for sweating on any particular part or whole body. Any offensive smell, bathing. If the aversion for bathing can be sepia and can be sulfur. Sorry, sepia loves bathing. Sepia loves bathing. Female complaints. As I said, female history, you need to take the menses history one thing. Any surgical history of females you need to take, and the leukorrhea patterns, the offensive smell patterns. Here you see, you need to ask any pain before interrogating any female symptoms, especially the menses. Ask, you keep a chat. Ask before kya ho jayega, after, during. Before, after, during. These three are enough. Before, what was happening? After, what was happening? During, what was happening? If a patient says, doctor, before I am getting pain, I get lot of breast pain. Can be lac canine. Leukorrhea after, before, during. This is enough. Now, coming to children's infants case taking. For the infant child himself, if they can speak and willing to do so by observing their acts and behavior inside the clinic, from the parents, if the child is sleeping or he is not willing to talk. In case of not acute condition like enuresis, forgetfulness, loss of appetite, sometimes the child doesn't complain, but you have to take the symptoms of the child in a healthy condition. Mind you, never take parental concern into account while prescribing in case of child. Do this. Everyone do the mistake. Sometimes parents show more concern than the child. This is what I want to say. If patient, because parents are very much scared and worried, all the parents are causticums. All the parents are prosperous because they love their child. If something about to happen, they express in a very, very big manner. Doctor, my child is not sleeping since 3 or 4 days. Kya ho jayega? I think he's having some anxiety problem, or I think he's not sleeping. He's screaming, very screaming. That could be normal for a child, but mother express it in a very, very intensified manner. This you need to understand. You have to evaluate the symptoms from seeing the child and take the symptoms according to into merit. Some children are slow to react, so don't be impatient. Repeat your questions till the child understands. Never get irritated with the child. Try to be friendly with the child. This is important. Try to be friendly with the child. Try to be friendly with the child. I will suggest you to keep a chocolate box in your clinic. If child comes, give the chocolate and start your interrogation. It will be very good. They will be completely open up what they are feeling. Never look into the eyes of child when he enters into the clinic. If you find the child is nervous or having fear over his face, can be beretta karma. Aversion to strangers. That is where you need to understand. Give some time to child to be familiar with you and other clinical staff. Take into account everything the child does inside and clinical, like touching items, as I said, can be phosphorus, stamping feet, gestures, other activities, very restless, playing here and there. If suddenly, if you play a music or if you have a color tune, then patients start dancing, can be tarantula. Dance, desire, rhythmic. How beauty, how beauty. This is the beauty of homeopathy. Observation of behavioral of some remedies. White coated tongue, mapped tongue, hot body, cold extremities, overall constitution you need to understand. Fat, thin. See, white coated tongue can be antimonium crudum. Mapped tongue can be nitrum mure. Cold extremities, hot body can be arnica. Overall constitution. If patient is so much of obese, can be cocculus, can be calcarea carb, can be calcarea carb. Kali carb and calcarea carb. Obese patients. And if obese patient with heart complaints can be antimonium crudum. Obese patient with heart pathology, fat, thin, tall, also critical to success in clinical practice. If a patient comes in front of you and sits like this, see the gesture what I'm doing, like this, and you ask the symptoms, you just keep on saying, loose neck, cannot hold the neck properly, nitrum mure. This you need to understand. Kali carbonicum. This is what we are going to do in our paid session very beautifully. I have given you some here. These are patients will not leave you. They will remain faithful to you. They will stick to you. But at the same time, they will not stop complaining. Suppose if a patient comes and says, doctor, you have given medicine, everything is fine. And a patient, you have explained everything fine, and patient have gone out of your cabin and again comes and asks, doctor, this medicine will work or not. Again he comes and that is the anxiety. That is the anxiety that Kali Carbonicum feels. They will keep saying, this is too difficult for me. How long must I go on like this? How long this treatment lasts? Why it is not getting better? Why is my pain? But they are not leaving you. Very faithful. The faithfulness comes from the strong possessiveness, I can say, the strong build of Kali Carbonicum, the strong duty bondedness, the strong sense of duty. So the rubric is similar to quarrels with his bread and butter, which means basically he quarrels with the person whom he feels dependent on. So there is a strong feeling of dependence and quarrelsome at the same time. This is a genius. Lycopodium, whenever any lycopodium patients you have done some work and you have given grateful and you have given gratitude, then lycopodium starts weeping, or they catch the shake hands very tightly. Oh, thank you, you have helped very much, and hugs you and having some weeping. Lycopodium. Thuja, very delicate body, very brittle, easily damaged. This is the psychotic miasm feeling of Thuja. Doctor, I hope your medicine is not too strong because my body may not able to take it. It is like medicine may be good for somebody else, but my body is being more delicate, more sensitive, more fragile, may get hurt by slightly by strong medication. These are the ways they manifest, and from these observations, you are able to gather their internal perception, even much more than the inquiry process. Observation in children. In children, particularly, observation become very important. MacCurve child often seem to have no will or choice of their own. Orphanage of materia medica is MacCurve. Orphanage of materia medica is MacCurve. This you need to understand. Calcarea carbonicum, interested in and aware, but they're too much because they are afraid of being repelled. Calcarea carbonicum having constant fears, very careful, very cautious child. Mother will say, doctor, no, my child cannot go anywhere because he feel that he will fall. Why he will fall? Because he feel his body is so weak. Very cautious, fear so constant is Calcarea carbonicum. Very cautious. Whenever no doctor drives bicycle, na, he's very cautious. He sees side and side if someone is coming or he may fall. That is cautious. That is Calcarea carbonicum. Fears is so much of constant, you can see. Due to the body is so weak, rickets, fragility, calcium, loss of calcium. A tarantula child will seek your attention, will come in front of you, will come in front of your camera. That is what tarantula. Very restless, very restless. Carcinosin child will remain obedient, well behaved, and model child. Phosphorus child can make direct contact with you. Like how doctor, suppose if a child is coming and he's seen for the first time. Ah, hi uncle, hi doctor, how are you? While going also, hi doctor. That is phosphorus. The extroverted nature of phosphorus child you can see. Now, at last, the summary. What to look in a case. When you approach a case, you begin looking for chronological of events. Ask questions such as when and how did it start? What were the first symptoms? Which organ is affected? What were the characteristics of those symptoms at the time? In addition, you will also look at the direction in which symptoms move. Which side did it start? Did it move? Did it stay at local area? This all I already explained. What are you supposed to take in a case? This you need to understand. Physical generals, perception, menses history, appetite, cravings, aversion, sleep position, also key in clinical practice, aiding to confirm the remedy choice. Family history, any alcohol or smoking history. Dreams also important. I'll tell you how about this. Suppose if a patient is coming and tell, doctor, I have dreams of robberies, I think in my home, every day I get robberies. Someone is stealing something, someone is taking my money, everything. Now, these indicate the subconscious mind of the patient. Now you need to interrupt, just not adding the rubric dreams of robberies. Try to understand what you feel exactly, dreams of robberies. Why you feeling? What is exactly feeling? Then doctor says, no, I feel that I am not protected, doctor. Now calcarea carbonicum, want of protection, want of some security. From there itself, the dreams are seen. The dreams of subconscious mind is important. Dreams of robberies. For example, dreams of chasing. Doctor, if someone is chasing me like anything, I feel my classmate is chasing. I am going on road now. I feel one of my friend is coming and chasing me. The competitive nature you can understand there, and itself the subconscious mind of the patient. He's thinking the friends are chasing me. He's thinking the patient. The person is chasing and becoming his object, or coming the chasing him and he is going in front of him. That is the ambitious or competitive nature of Axomika. So these dreams pattern are very important, and I am coming up with more importantly the dream patterns in my paid session. How to understand the remedy and the subconscious mind from the dreams and the delusions. That will give you a clear picture. What a homeopath ultimate aim. Try to find the location, sensation, and concomitants in a remedy. Investigation. The investigation should be in the mental and emotional and physical. This you need to understand. Investigation is not only the proper lab reports. The investigation should be in the mental sphere. The investigation should be in the emotional sphere. The investigation should be in the physical level. When this all three is matched in a triangle, then your remedy of investigation will be sure shot, no doubt. What is important? You emphasize the importance of peculiar symptom, because that is what will ultimately help to match the patient remedy. You also place a great importance in concomitants symptoms, as they will help to do quantity and qualify the expressions of the patient. When we should take mental symptoms, this is what I want to say here. So when we can interrupt this mental symptom, don't start asking mental symptoms from starting itself. Try to ask the mental symptoms at the last. That is what I said. My case taking last, what I ask is, patient, like what you have major impact in your life. That tells you the mental symptom. Because mind symptom or mental symptom patient cannot give you at the starting point of your sitting. While interrogating chief complaints, dreams, physical generals, then patient feels free. Okay, okay, doctor is listening about me. I must open up. Patient feels free. Then he starts giving the mental symptoms. Try to keep the mental symptoms at last of your case taking. Understanding the patient is important. Who is in front of you? How he is speaking? He is masked, or he is hypochondriacal? He is shy? He is strange? He is extroverted? He is introverted? His gestures, his observation, or his cunning nature? Everything you need to understand. Analyzing at last, you need to analyze all this. Once your patient is weeping in front of you, that is the best example that there is a good bond is established. When patient shares the emotional picture, the emotionally attached feeling, that is where the patient is so much of attached to you. That is where the patient have faith on you. That faith you must not ruin, my dear friends and colleagues. Try to serve the patient with the right remedy, and that right remedy should be your single remedy, not mixing remedy. The minimum remedy, single simple minimum, single simple minimum. And organizing your totality. How you need to organize the totality with mind, symptomology, toxicology, and pathology. This is the organizing of your totality is important. And how to choose minimum? At each level of the case, you choose the symptoms that are faithfully reliable, dependable, and solid. Once you have a good grasp on these symptoms, you have few remedies in your mind. So that is what, try to narrow your remedies. Whenever you are taking a case, narrow your remedies must be in 4 or 5, not your remedies must be in 10 or 12. When it is in a 10 or 12, you are going in a wrong track. Try to narrow your vision. Try to see only few remedies, what patient is, who is the patient is. Then eventually you will hit the right remedy. Thank you all. Thank you so much who have joined with lot of faith here. And please do share your feedback. Many people are not sharing the feedback. Please, everyone, please spare 1 minute of time, because I am putting a lot of hard work and lot of essence of collecting matter from many literatures, and we are coming up with Kalisals and its comparison. Please, who are interested, they can start paying now. I will be sharing the details in the group, and please share your feedback as well. Six months of access will be given. I think 15 remedies, each remedy will be cost of just 20 rupees, just 20 rupees, and you will learn more and you will evolve more. We are coming with some more free sessions as well. So please do share your feedback in the group, wherever you are, in Instagram or in your Telegram. If you don't have my WhatsApp link, please text to this number. This is my WhatsApp number. You can text it and we'll share your WhatsApp link. You can join there. Please, everyone, do share your feedback. Thank you. Thank you so much for your patience here.